It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is Kindred Healthcare. Joining me is Lisa Venanzi, the clinical liaison of Kindred Healthcare. Welcome, Lisa.
Hi, thank you, Joe. I appreciate you having me here.
Well, I'm glad to have you here for several reasons. The primary one being, I think that people need to understand that Kindred is more than just healthcare. It's a hospital, it's an in-home skilled nursing care service, but you've taken over an organization formerly called Gentiva, and it now comes under the banner of Kindred Healthcare, and you have, I think, become the largest skilled nursing in-home care corporation in the United States.
Well, that is pretty well said. We are the largest post-acute care healthcare company in the nation right now. We actually are the fourth largest healthcare employer. Kindred started off in the skilled nursing sector, and we grew from there. So now we are, as you said, Gentiva, formerly Kindred at Home now. We are Kindred Hospital, like the transitional care hospital we have in Melbourne here, across from the airport. We also have skilled nursing facilities, but we don't, however, in this market. We have inpatient and outpatient rehab as well. So Kindred is in 47 states, but I always say that Kindred Hospital Melbourne is the best kept secret because nobody really knows what we do. They know what we don't do because our sign says no emergency services. But beyond that, people have no idea.
I'll be honest. I have driven by that hospital so many times, and I've really not known what goes on there. And when I've been closely associated with Gentiva for years, because Gentiva was a splendid organization. And in fact, they took care of me and all my post-surgery, my post-operations and everything. I trusted them.
Right.
So I know that they were acquired by a good corporation, but people need to know more about it because we have Holmes, Woodstock, and Parish Medical Center in Brevard County. But we have another long-term care place, a hospital, that some people could say it's a nursing home, they could say it's an assisted living, they could say it's a number of things. But that's what we want to talk about today, so that as we advocate strongly that Brevard is an elder-friendly community.
That's correct.
If it's going to be an elder-friendly community, people need to understand the services that are provided. So our first question is, what do you really do? Let's say with Kindred Healthcare. Now you explain it to our viewing audience.
Okay. I am a clinical liaison. So my job encompasses this education and outreach. In addition to that, I have responsibilities to see and assess patients that are in ICUs and the Woodstock hospitals, the parish hospitals, and Holmes Regional Health First Hospital. So see, we all work together, but we are the only transitional care hospital, and we have the certificate of need for Indian River, Brevard County, and Osceola County. We get patients from all over. In fact, I had a patient fly in from Puerto Rico. So what type of patients and who comes to us? Well, basically, they're the sickest of the sick. They're about 2% of the folks that are in an ICU that don't get better in days. And that's how we kind of look at patients and where they are in the recovery is in terms of days. When you've gone much past a week to 10 days, there has to be some planning put into place because the ICUs in traditional hospitals were never designed to keep people for weeks. They were designed to keep people for days. And, great thing, pharmacology, knowledge on disease state, all those things have enabled people to survive, but they need longer. So Kindred provides care instead of days, we provide it in terms of weeks. And where Kindred Hospital is one of the best in the country, the best of weaning patients off of ventilators.
Well, at the Kindred Hospital here in Melbourne, in Brevard County, how many patients can you take care of there?
We have 60 beds. Very good question. We have 60 beds, and all the rooms are private rooms because of the high level of acuity of our patients. All of the beds can handle a ventilator. We could handle 60 ventilator patients. 30 of those beds are plumb bedside for dialysis. We have 2 OR suites, so if you come to us and you have to have a surgical procedure done, you can have it done right there at Kindred Hospital. So really what I tell people is the easiest way for me to explain who we are is to tell you who we aren't. We don't do pediatrics, even though Kindred people kind of think of the root of Kindred spirit and think that we do pediatrics. We do not.
You say you don't do wound care?
No, pediatrics.
Okay, pediatrics.
Mm-hmm. We don't deliver babies. We don't do labor and delivery, and we don't have emergency services. Majority of our patients do come from an ICU or hospital setting. However, they could come from their home health. Say you were declining, you weren't doing so well, and it looked like you might need some additional care at a higher level. You could come straight to Kindred from there. So
can doctors admit directly into Kindred?
That's correct. And we have an open staff. So physicians can have privileges with us, provided they fill out the package and everything is done properly there. We do not exclude anyone from having privileges. If a physician does send their patient to us, we have a list of attending physicians to cover, so they don't have to have another place that they have to go. Their days are very stretched thin as it is.
Okay. Health First is an HMO, and they have their own doctor network and all that. Mm-hmm. But you're saying that doctors in the Health First network are doctors that are on staff for Wusthof or Omni doctors. They can all come to Kindred? It
depends on what their contract is on their end. In other words, some of the Health First physicians have a contractual obligation that they cannot have privileges at another facility. But as far as Health First, the HMO is concerned, Kindred Hospital has a contract with them because, quite frankly, the patients need some place to go. So we all work together. When I often say to people I work for Kindred Hospital, a normal response will be, well, I go to Holmes Regional. I say, well, that's great, but let me explain why you might have to come to us, and I hope you never do, but you need to know about this as an option. So again, we're kind of like the Switzerland of Brevard County.
This is something that people, I'd like to talk about the terminology, elements of care.
Right.
I like to say, I want to keep myself in my own home as long as possible.
Right.
If I got to the point where my memory was affected and it was too much for my wife to care for me, she might be able to farm me out to daycare a few days a week to give her a break.
Right.
The next step, if I can't stay at my home, or maybe bring a nursing service in, like Levin Healthcare or something like that can do
private duty.
Private duty to help my wife take care of me, and I can still stay at my home. My long-term health care insurance to cover that. But then I go to an assisted living facility, and then if they can't handle me there, I go to a nursing home. But then if I get in that nursing home and I'm in declining health, and a nursing home can't care for me. Do you get a candidate like that into Kindred?
We do. Yep, okay. Absolutely. And that's through our direct admit program. So to make it as simple as possible, in healthcare, sometimes we talk about zones. So there's the green zone where the patient is doing well. There is the yellow, which is a cautionary. We need to step it up and watch more closely as to what's going on with the patient. And then there's the red zone, which is really a 911 an emergent situation. So what I tell people is, and the nursing staffs at the skilled nursing facility, when a patient looks like they're going yellow, kind of orange, then they're a Kindred patient, most probably. That's one of the benefits that Medicare provides, is for patients who are not thriving at their current level of care to go to a higher level of care. And that's all arranged within a couple of hours.
Okay, some of the rules that apply to hospitals, like if admitting a person for observation or admitting a person as an inpatient or an outpatient, that wouldn't apply in Kindred.
No, observation is used often when, I guess, the emergency department determines that the patient just needs a limited amount of care and monitoring, and they can make the patient stable enough to be able to release them in a short period of time. My concern is not always that the patient doesn't necessarily know that they're in observation. So it's a good idea to often ask, or a family member ask, is my loved one being admitted or are they in observation? And the difference is going to be with your Medicare. If you're in observation, the patient is responsible for 20% of that billing. If you're inpatient, Medicare A covers all of that. So it's a little bit different, but could be a significant difference to your pocketbook.
So how is care paid for at Kindred, generally speaking?
It's paid through Part A. And so it's the same that you would have for an inpatient stay at one of the traditional hospitals that you think of.
So Medicare or
Part A.
insurance? Do you ever get anybody that's totally private pay?
No, I can't say ever. It's rare. It's just very rare.
Rare. It's
Right.
rare. I think we were talking about how Kindred is different from the other hospitals, but what else in that part of understanding what Kindred does and what it doesn't do? What else? Is there anything else that sets Kindred apart from Gustav, Holmes? What is that?
It's probably the easiest is the length of stay. Like I said before, hospitals generally look at the patient's length of stay in terms of days, and ours is generally in terms of weeks. There's daily physician visits, much like you would have at a traditional hospital. We have all specialties on staff. We have respiratory therapy, skilled nursing 24/7. We have occupational therapy, speech therapy, all rehab, gym, a lot of the same things that you would see in a traditional hospital. But again, you're there for a longer period of time to heal. And that period of time often makes the difference in the outcome of what happens to a patient in the next step of the continuum. So you hit it on the head when you said, okay, I'm at home with home health, then I might go to an assisted living facility, then I might go to a skilled nursing facility. But if I'm declining, I could go either to a traditional hospital, depending on what zone I'm in, or I could go to Kindred Hospital so I could find time to heal and be discharged back.
A lot of times it's been my experience that people are discharged from one of the traditional hospitals to rehabilitation services like those offered at Sea Pines or Melbourne Terrace, where they have I was in one of those for 15 days recovering from a stroke.
Right.
Could I have done the same thing at Kindred or not?
Well, I can't necessarily answer that without knowing where you were clinically, but I can explain it as simple as this. Sea Pines or Health South is licensed as an inpatient rehab. And with that being said, their thrust of care is done through therapists, physical therapy, occupational therapy, all the rehab. So about 70% of that care is focused on rehab. Now at Kindred, 70% of our care is really focused on medically stable, getting you medically stable enough.
Getting you well.
And then 30% rehab. And as you improve in that continuum, it goes 60-40 until finally there is a discharge plan for you to go someplace else. And it may be to Sea Pines.
Since I managed a hospital at one point in my Navy career, and I had assisted floors working in a nursing in home that I managed, I'm seeing that there's an element of care here that we really haven't talked about. We really have not talked about on radio. We haven't talked about on TV before. It's not really covered in the newspaper. You don't see it covered. You see financial people talk about financial planning, estate planning, elder law attorneys, and everything else, but you don't hear medical people talking about the type of care offered at Kindred. I know that ICU beds are limited, and they try to move people in and out as fast as they can. It would seem to me like they would want to use Kindred more, and I guess I'm not really understanding. Is Kindred overflowing, or could
we are at capacity now, which is unusual because usually this time of year our census tends to wind down a bit, but that's not what's happening. We are maxed, and we are looking for RNs. So if you know an RN that wants to come work at Kindred, please let me know.
So you're short of staff.
We are short of staff, as of most of the hospitals here in Brevard County. So,
I know an RN, I'll tell her.
There you go.
But the other part of the question, Lisa, we're talking about here is we're having people understand that Kindred Healthcare is composed of the Kindred Hospital System and the Kindred In-Home Care now. And Kindred In-Home Care now encompasses the former Gentiva skilled nursing system. Did Kindred Healthcare have their own in-home service before?
Yes, we did.
You did?
But we didn't have it to the extent. Gentiva was the largest and the best of what they did, and still are.
Yes.
The only thing that's changed is their name. The staff is pretty much the same. We took over and looked and learned from the different services that Gentiva offers. So really, it hasn't changed, but by name only. It's still the same high-level quality healthcare that you were seeing before.
But I would see a little difference here. Knowing how the hospitals operate and how I think you intend to operate with the acquisition of Gentiva, when you mentioned before that you had speech therapy, occupational therapy, and physical therapy in your hospital, and about 30% of that was focused on the whole part of the concept. But now you bring in the largest home health care corporation in the United States, who already has an outstanding occupational, speech, and physical therapy branch. When you marry those two forces up, it seems to me like traditional rehabilitation services might be hard-pressed to provide.
Well, we do own a rehab, inpatients and outpatient rehabs in the country too, but we just specifically don't have an inpatient rehab hospital here. The certificate need is with Sea Pines Health South. So your point is well taken. Does a patient need an inpatient rehab upon discharge from Kindred? And it really just depends. We all heal differently. And just cookie cut a plan together would be doing a disservice to the patient and the family. We have case management there at Kindred Hospital that have been trained, and they're the best at determining what is the best place and safest place for that patient to be discharged to. So there are a lot of choices, and that's really what my job is to do, is to say when you or your loved one is in the hospital, don't just think traditionally that once you get discharged, you're either going to go home with home health or go to a nursing home or a skilled nursing facility. There are lots of other options, with the highest acuity level being Kindred Hospital.
See, this is one of the reasons that I'm a strong believer that these television shows need to be produced, but we need to bring more on our little known parts of our care system in front of this TV camera, so that the 545,000 people in Brevard County and those others that see what we're doing worldwide, because this show will be on worldwide YouTube.
Right.
So somebody plays, you said Kindred was in 47 states?
That's right. And we have a new service called 866 Kindred. And it's open 24/7. You call 866 Kindred, and it is manned by RNs 24/7 to answer healthcare questions. It's free. So it's not just, depending on where you are calling, they're going to look at the market and see what kind of services are in that market for you to use. It doesn't have to be Kindred. It could be anything.
I wrote that down there. I said how to contract both hospital and Kindred at home care, but I didn't understand that benefit. Help viewers understand the ads and relationship between 1-800-KINDRED.
Yeah, 866 Kindred. And those ads have just started running in this market here on ABC, CBS, NBC, and Fox. And basically it explains that if you have a healthcare question, much like the questions we're talking about today, does Medicare cover this? If so, is there a copay? What are my options? If my loved one's getting discharged from the hospital, what resources do I have in my community as far as facilities and services? And it's a wonderful free service. And there are RNs, so it's not just lay people talking about healthcare.
See, you're doing the same thing that we at Helping Seniors have advocated for 5 years. And I did this when I was the director of the Alzheimer's program. We did much the same thing that we're doing today. I started this 9 years ago, that the objective was to inform, educate, and connect. We want to make sure people understand.
Right.
How do they understand? They have to either read it,
Right.
see it someplace,
Right.
or hear it.
Or have an advocate. Or have an advocate.
Right,
I say that often, and people look at me, advocate. I said, would you ever enter a courtroom without an attorney? No. Then why would you enter a hospital without knowing what other resources are going to be after the next point? And quite frankly, I understand that you're in a crisis mode a lot, and you're thinking about other things and how you're going to handle this, and just, it's not a good time.
Okay, now that you've acquired the Gentiva and are now called Kindred at Home, I know that Gentiva, when they operate under the Gentiva banner, 99% of their clientele was skilled nursing care and through Medicare.
Right.
We still do that.
Correct.
But have you added, or do you serve private insurance as well, or private pay under that banner also, or not?
Generally speaking, your Medicare does cover the home health services, so that would be who would be funding it as far as the resource.
Yeah, but how about people under 65, Lisa?
Under 65, then it would depend on their individual plan. It really does.
Okay, so all the more reason for people to understand this Affordable Care Act has not really solved the problem.
No.
We have 20 to 30 million people out there that don't have the type of Cadillac plan that covers this coverage.
Right.
And they think that, but when people buy insurance and they have a problem, they ask about my coverage and they say, you don't cover it, you're not covered. And they can't accept it, they don't understand that.
Right.
And we get questions like that all the time. So we work with the SHINE people a lot. And a lot of people, I've had people say, oh, I used to be a SHINE counselor, they don't know what they're talking about. That is not true.
Yeah.
Generally speaking, a SHINE counselor is going to get you pointed in the right direction. And what I'm hearing you say is that this Kindred 1-800 is, I'll call up myself and ask a question. That's what I do.
Yep.
I test the system.
Right.
I know that if somebody calls our 473-7770 number and our information specialist gets the phone call, she listens to the person.
Right.
And that's extremely important. You can hear what a person says, but you may not understand them. You have to listen, hear, and understand. If you don't understand what the problem is, or if you don't extract the problem from the person, you can't direct the element of care to them that they need to have resolved.
Right.
That's what I'm hearing you say Kindred Healthcare is doing under some of this new formation.
That's correct. There is a lot of misinformation. And like you're saying, when you go to buy a health insurance plan, sometimes it can be quite complicated and the literature behind it can be lengthy and cumbersome to read. But I've seen on several occasions that, an insurance company may say, oh, yes, you have a home health benefit. Well, the home health benefit might be for just 3 visits. So you have to dig a little bit deeper. So 866-KINDRED can help in those arenas. Now, sometimes different plans, there could be several different types of Humana, several different types of Blue Cross, obviously. But do your due diligence on the front end and make sure your family knows what your wishes are. It's imperative, especially at a time when you are that sick in the ICU.
That's so important. A question that I wasn't going to ask, I'm going to ask you this. What's your background?
Well, my background's a little scattered. I was a pharmaceutical rep for many, many years. And the clinical aspect of my life I worked as a nurse in Arkansas, and then when I moved back here, I got into pharmaceuticals and enjoyed that industry. One of the passions I have about my job now, and it's the light bulb moments, when someone looks at you with a sense of relief, like, I didn't know that Kindred existed. I didn't know that this was an option. And I get the most fulfillment out of educating and helping people navigate the process. So that's my background. I started in pharmaceuticals, which gave me a great foundation for building communication skills and understanding that if you build a hospital, people aren't just going to come. You have to let them know what you're doing. And so one by one, I get to be the Pied Piper and tell them, that this is an option. And I thank you for having me on your show because this is great.
But, and do you conduct any training with your outreach people that like your clinical discharge people, the people that work with the families when the patients are discharged? Do you have periodical meetings with them to explain what you and I are talking about?
Well, we do gather information from WebMD and some other websites that we're rated. We want to know and we are a 5-star facility. So we want to know how we're doing in the community and what the families think of us and what the patients think of us. And if they would come back. In fact, I have a patient just yesterday afternoon who wants to come back because they love the care that they received and they feel like they're declining in health again. But
see, you do a wonderful job of explaining what Kindred Healthcare does and what it doesn't do.
Thank you.
And the difference between a hospital. My concern is always, every time I get somebody on one of our radio or television shows that understands it, I'm always concerned about, are they or could they be doing a better job of imparting their knowledge to the people on their staff so that they can connect with the other people? Because you can't do it by yourself.
No.
Nor can I.
Right.
I can produce a TV show like this, and I can get you to explain it.
Right.
But we have to ensure that we have people farther down the echelon that are understanding what you and I are talking about. And the viewing audience themselves,
right,
if they get a better handle on what's not happening,
right,
they can help their friends and family understand where they can go to get a question answered.
That's right.
In the time left, what else would you have to say about Kindred Healthcare, Kindred Hospital, or Kindred at Home?
Well, I think Kindred's a great company to work for. I think our mission statement really sums up who we are as a healthcare company and as a most admired Fortune 500 healthcare company, in that we provide the care to people. We promote that healing. We're providing some additional hope. We're protecting their integrity, and we're providing value for the healthcare that they're receiving. And you just need to be your own advocate, and you need to be there for your family when they need you to help navigate the system.
Thank you, Liz. We're out of time.
Thank you, Joe.
We'll have you back again.
I would look forward to that. Thank you.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.